Ladies and gentlemen, I'm Dr. Silva, and thank you for joining me for this talk on how to pick a good therapist. Psychotherapy can be extremely helpful, and it's almost always a good idea if a person is at all interested in it. I never discourage a patient. There are a few contraindications. There are a few times when it's not a good idea to do therapy. If a person is very symptomatic, if they're very depressed, or if they're acutely manic, or if they're psychotic, then obviously there are limitations and a person maybe should not engage in therapy. But otherwise, a person is a good candidate for therapy if they're interested in therapy. And even if they're not particularly introspective, those are habits that can be fostered. So if there are no contraindications and the patient is interested in it and the client-therapist relationship is a good fit, then it's a good indication. Unfortunately, as many people have experienced, a trial of psychotherapy might result in disappointment or even greater confusion. Some therapeutic alliances between professional counselors and their clients go terribly awry. In some instances, this is because of the relative inexperience of an otherwise well-intentioned therapist. In other instances, it may be due to a therapist's gross negligence or his or her own psychological morbidity. We're all human beings, and you definitely have to have your together in order to help other people. In still other cases, though, it's simply due to a poor match. Some client therapeutic alliances just aren't meant to be. Because the start of a successful psychotherapeutic endeavor begins with the therapeutic relationship itself, selecting the right therapist is of paramount importance. It is the most important thing. It's also one of the most uncertain tasks. Geography is not so much a practical consideration anymore with the advent and rise of telehealth, telemedicine. Now with Zoom sessions, the geographic limitation is licensure. It's according to licensure. So for example, I get lots of requests from viewers for consultation because they're watching all over the country and in other countries, but I'm only licensed to practice in Texas. And so my patients have to be in Texas, and when we conduct our sessions, we both have to be in Texas. Those are the laws. I only have a license to practice in Texas. And so there are still some geographical considerations, but there's also availability issues. People sometimes need appointments right away, and then you've got financial and insurance requirements. All of that comes into play when you're trying to select a therapist. The topic of selecting the right therapist could fill a book. This video is going to touch on a few things to consider when you're making that selection. I do a separate video on how to embark upon meaningful, successful psychotherapy by setting goals, avoiding common pitfalls, and engaging your therapist. But this video is going to be about how you pick the right therapist. And because there's no practical way of comprehensively screening a potential therapist before therapy actually begins, in fact, it's often not until therapy is well underway that both the client and the counselor begin to develop a true sense for the other person, you'll probably have to settle for an empiric trial and error process. But the following guidelines should improve your chances of success without encouraging therapist shopping. You'll see that while it's reasonable to interview a potential new therapist on the first visit before committing to weekly sessions, you'll want to resist the urge to shop around for someone who's only going to tell you what you want to hear, enable maladaptive behaviors, or just validate you without asking you to really examine yourself and take a critical look at your choices in order to effect real change. It's not always a comfortable, pleasant experience, but if you invest in it fully, the rewards can be great. Credentials. In searching for a good psychotherapist, you'll certainly want someone with acceptable credentials, which involves 4 things: schooling, training/experience, certification, and more experience. Experience is really the most important. Nothing is more important than experience. So there are various types of degreed professionals who engage in psychotherapy, primarily social workers and clinical psychologists, and some psychiatrists. But although psychiatrists like myself are medical doctors whose formal education and training is the most extensive of the group, MDs, medical doctors, and DOs, doctors of osteopathy, which they have very similar training, they're not necessarily any better at providing professional counseling services than social workers or psychologists. In fact, doctors may be significantly less prepared in that respect. And this is because physicians of any specialty are licensed to conduct therapy, despite the fact that they're not required to take any psychology or sociology courses as part of their pre-med curriculum. There's no psychology in pre-med curricula. And likewise, as medical students, we're not schooled in psychotherapeutic principles. All medical students are required to rotate through psychiatry, but we're focused on diagnosing, we're focused on psychopharmacology, pharmacotherapy. And so even graduate students, where I'm talking about interns and residents, and maybe even fellows for people that want to subspecialize, medical doctors that have decided to focus on mental health and commit themselves to mental health services and becoming psychiatrists, they may or may not be extensively schooled or trained rather in psychotherapy. We take a brief basic course in behavioral health the first or second year of medical school. That's before psychiatric rotation in either the third or the fourth year. And again, while we all are required to go through it, you get a few months, and then the resident may or may not spend a significant amount of time practicing counseling under supervision, depending on the specific residency training program. My program did emphasize psychotherapy, so there was lots of structured and supervised therapy all 4 years. We even had to do a psychoanalytic rotation, which is the Freudian school of psychoanalysis, and it's a very specific kind of therapy that I don't think has much utility, but there are still institutes these days. Anyway, we had to do psychoanalytic supervision as well, but in any case, that was not the primary focus of residency training. Psychiatrists are medical doctors first and foremost, so they concentrate on diagnosing mental illness, ruling out treatable physical causes, and managing symptoms with medications. Some residents in psychiatry receive surprisingly little in the way of formal instruction regarding psychotherapy, so don't assume that just because doctors have endured a rigorous and lengthy program of education that makes them better therapists. The only distinct advantage to having an MD or a DO as a therapist is that your therapist then also has prescriptive authority in the event that you need or would benefit from a trial of a psychotropic medication. A lot of times that is determined in therapy, but a therapist has to refer the patient to a psychiatrist for an evaluation for medication. A therapist comes to know you very well with the typical once weekly hour-long sessions. So if and when it becomes necessary to prescribe or adjust a medication, such an arrangement places the prescribing physician at an enormous advantage in terms of being able to consider in depth the psychosocial factors relevant to your situation before deciding what to recommend regarding the medication. And really, a psychiatrist should always consider the context and should always consider psychosocial variables, but they often don't. The reality is that a lot of psychiatrists, they have a lot of patients, they have to see in one day. They want to have a rapid turnover so they can make as much money as possible. I'm just being honest. They have these 15-minute med checks, and a lot of times in their own mind, they don't have time, quote unquote, to really engage the patient. I think that it's not acceptable. You really have to know what the context is, and you have to attend to those psychosocial variables if you're going to do a good job. But if you are the therapist, if the prescriber, the psychiatrist is the therapist, and you're seeing that patient, even if you're only meeting every other week, you're still spending far more time, far more often with your psychiatrist than you would otherwise. Imagine the advantage of having a full hour as opposed to the standard 15-minute medication check every few weeks or months that's currently the industry standard. I spend 20 minutes with my patients, and I always do a little bit of supportive therapy, and I offer 30 and 50-minute appointments. So I do therapy, and I'm definitely very focused on that. but not all psychiatrists are. I think if you go see a psychiatrist for therapy, though, you're going to see the kind of psychiatrist that has an interest in psychology, that has an interest in doing psychotherapy. So most psychiatrists don't do it, so you don't have to worry about seeing somebody who's not going to attend to you, because if the psychiatrist doesn't want to spend 50 minutes with you, they're not going to spend 50 minutes. And it certainly doesn't take more than just a few minutes to talk about medications. Usually when we're looking at target symptoms or side effects that we have to deal with, it doesn't take me very long unless the patient's not doing well. But because psychiatrists and independent therapists are not always easily able to coordinate care, ideally, in an ideal world, a psychiatrist would be calling your therapist. But the reality is that we just can't spend that much time on the phone or faxing records to each other or reading each other's records. And so having a therapist who's also your psychiatrist and vice versa can definitely be an advantage, assuming that your psychiatrist is adept at therapy. And so I just want to make it very clear. The combination of seeing your psychiatrist for therapy practically guarantees that you'll receive better psychiatric treatment, diagnosis, and medication management. But it doesn't necessarily mean that you're getting the best psychotherapy. Licensed professional counselors. As for social workers and psychologists, all licensed professional counselors, LPCs, in Texas must have a master's or a doctoral degree in counseling or a counseling-related field, quote unquote, from an accredited college or university. So here again, a PhD doesn't necessarily make for a better therapist for a given client than someone with a master's degree, because the ability of a particular therapist to help you depends on a number of factors, least of which is whether or not that therapist completed a dissertation as a graduate student. When it comes to credentials, check for the minimum requirements, although if the therapist is licensed, the state in which the person is practicing has already done that for you. But beyond that, don't base too much of your first impression on how advanced the degree is or which institution of higher learning granted it. There's absolutely nothing to indicate that a Harvard or Stanford graduate is going to do a better job working with you than the therapist who spent the first few years earning their degree at a local community college. Therapy is an art, not a science. Many aspects of it can't be learned except through direct experience, and some people are just naturally more gifted with regard to practicing it. Also, therapy is a collaboration, and the right fit often has little, if anything, to do with how accomplished the therapist's academic career was before sitting down to meet a client for the first time. Certification. That said, there are subspecialties in which LPCs can become certified. And inasmuch as these certifications indicate additional experience in a given area, they're certainly a source of added confidence. If you're seeking treatment for drug dependency, for example, you probably want to see an LPC who is also an LCDC, a licensed chemical dependency counselor. And although it's not a requirement by any means, still, if substance abuse is the focus of treatment, you might even consider a therapist who's also a recovering addict themselves. Such individuals are especially equipped to guide you through the process of your own recovery in a way that others who've never personally dealt with addiction simply are not. I myself am in recovery, and I can tell you from experience that I do bring something to the table that a person who's studied addiction, even a person who's very accomplished, if all you have is textbook knowledge, then there is something missing. And again, I'm not saying that I am better than all the LCDCs out there. I'm just saying that I am better than I would be. Okay, I'm comparing myself to myself. As a counselor, as a sponsor, as a psychiatrist working with someone who is battling chemical dependency, I'm better because I myself am in recovery. I myself am maintaining that. And I went to rehab, and so I have that direct experience. Sometimes patients will be resistant to what I'm saying, and sometimes they're argumentative. And then when I reveal to them that I myself am a recovered addict, they stop arguing for a little bit because it's surprising to them, but I think it's also a source of added confidence in the treatment that they're going to get with me. I tell them because I believe it will be conducive to their treatment. And it is. Other counseling subspecialists include cognitive behavioral therapists, child and adolescent therapists, couples counseling, family counseling, group therapy, and psychoanalysts, to name a few, as well as eating disorders specialists. So if you have a particular problem, you might find a therapist who is a niche therapist, that they see a very special subset of people. Also, the LGBTQ individuals sometimes they'll feel more comfortable with an LGBTQ therapist, and particularly individuals with gender dysphoria, transgendered individuals, they might seek out someone who is a member of the broad LGBTQ community. Definitely beware the quote-unquote life coach with absolutely no official credentials whatsoever. There are actually state laws governing the way in which these unlicensed individuals are allowed to advertise their services, but claims can be misleading. The Texas Medical Board, as part of their monthly disciplinary proceedings, will issue cease and desist orders against unlicensed individuals who are maybe claiming to be doctors, or that they appear to be implying that they're doctors, or also medical doctors whose licenses are suspended, who aren't supposed to be practicing, or who aren't board certified, but whose advertising materials again imply or explicitly state that they're board certified when their board certification is lapsed, that sort of thing. But some practitioners may refer to themselves as life coaches and actually be schooled, trained, and properly certified. So I'm only referring to individuals with no formal training whatsoever. And then I do want to say a word about pastoral counselors, ministers and rabbis and priests. They obviously don't have any formal schooling. Seminary training is not accepted by the state of Texas anyway, and so they can't apply for licensed professional counselor credentials and take the exam and get that certification if they haven't gone to an accredited university and they haven't studied sociology or psychology, or theology may be okay, but you have to actually have a degree in it and not just be somebody who went to seminary school. So it just depends on the institution. Experience. Do pay attention to how many years a therapist has been in practice. It bears repeating that the best credentials are not diplomas and certifications, but actual experience. The formal training that qualifies for state licensure always includes a significant amount of supervised experience. This is not to discriminate against those therapists who are just starting out, but as with medical doctors, the more time a practitioner has spent in practice and the more clients they've treated, obviously the more opportunity they've had to master their own strengths and weaknesses and to learn from their mistakes. Seek the best fit. At the end of the day, a fully credentialed, board-certified brain surgeon is going to do the best job they're capable of doing, regardless what type of person the brain belongs to. But when it comes to engaging the mind, even the most seasoned clinician with one of the most well-honed techniques may not be best suited to you. You want to also pay attention to their style. Someone who may be a wonderful therapist for one type of client may turn out to be a disappointing choice for someone else. Again, therapy is an art, not an exact science, which is why MDs and PhDs, even those extensively trained in psychotherapy, are not necessarily better equipped to counsel you through your particular problems than someone with less formal training, but who's perhaps culturally and ideologically a better fit, or simply someone with more innate talent for therapy. The problem, as already mentioned, is that it's difficult, if not impossible, to know from the outset who is going to have the best approach for you and with whom you're going to relate the best over time. You won't know if you're going to click with your new therapist until it starts to happen. Sometimes you get a good feeling on the first visit, but the therapeutic alliance is a relationship, a special kind of relationship, but a relationship nonetheless. And as in real life, meaningful and rewarding relationships build over time with the establishment of trust and the building of familiarity. it's reasonable to screen a potential therapist at your first appointment. Although the clinician will be performing a formal interview and will have a lot of questions for you, one of them should be what you expect to gain from therapy. And in the context of discussing that, a good therapist will welcome inquiries from you regarding their therapeutic philosophy, their experience, and their style. It's a start. Give it time. Ultimately, this is the only way that you're going to be able to make an informed decision. It may take several visits to get comfortable with a new therapist and to fully determine whether or not therapy is going to work between you. The following are some specific qualities to look for in a therapist. Some of these you can ask about, but most you'll have to discover for yourself. And the way to begin is to be aware of them. And these are not techniques that the therapist can learn about and go hone. But for the therapists out there that are watching this video, these are qualities in yourself that you can cultivate, you can foster. So ask yourself, do I have these qualities if you're someone who is doing therapy or who is interested in going into therapy? The first and most important is empathy. Ask yourself, does the therapist seem to care? Are they engaged with you? Do they ask a lot of probing questions that invite you to stop and consider and reveal yourself a little in the answers? And when you go to answer, are they listening or are they just waiting to ask the next question? Body language and eye contact are things that a competent therapist is going to be evaluating in you. So they have to be looking at you. They have to be listening with their eyes as well as with their ears. But you'll also take your cues, consciously or unconsciously, from the therapist, from their demeanor. So take note if your new therapist seems distracted or disengaged. I've heard plenty of sad stories from patients about therapists actually yawning or looking bored in the middle of a session. And yes, even falling asleep. More than one patient has told me the therapist fell asleep on me. One patient described to me how put off she was by the therapist slurping coffee when he met her for the first time. And it wasn't just the fact that he was drinking coffee, of course. It was the disaffected tone in his voice and the way he peered at her dubiously over the rim of his cup. But she described to me how the slurping got on her nerves. But it was the fact that he was more interested in drinking his coffee and peering at her over his coffee cup than being warm and being engaging. And what I'm talking about, this lack of empathy, this lack of engaging and really being interested in you and trying to find out who you are and why you're coming to them. If you're not feeling that piece of it at the beginning, you really might reconsider a second visit, because this is a professional that you've come to see. If your counselor seems indifferent or spends a lot of time quickly asking rote questions that they obviously ask everybody with no real interest in your answers and no follow-up questions that are tailored to your responses, and if they don't bother to look up much from their notepad that first interview, a good therapist takes notes on the first visit, by the way. Take these as precautionary signs. And if you're going to give the therapist a second shot, which I think is generally a good idea, and you see more of the same, cut your losses. There's an entire school of thought built around the notion of empathy for one's clients. Carl Rogers' client-centered therapy, which was developed in the 1940s and 50s. Later, it was rebranded as person-centered therapy, but it was the founding movement in the humanistic school of psychotherapies. And it relies heavily on the notion of quote-unquote unconditional positive regard that a therapist should demonstrate for their client. Rogers believed that people would naturally tend to move toward personal growth and healing if they were merely allowed the opportunity, and if a safe space was created and they had a relationship with someone who didn't judge them and always assumed the best of them and was accepting and tolerant. And he believed that just anybody would get better that way. And I don't know that anybody would. I mean, I think, the hardcore meth addict, antisocial personality disorder is not going to have personal growth and all that if you just put them in a situation where the therapist is listening and is engaged and caring. But Rogers believed that the principal aim of therapy should be to allow that spontaneous process by fostering a comfortable, non-judgmental environment and demonstrating, quote, the utmost respect and regard for the client. So chief among the therapist's tasks was to listen and to try to understand how things were from the client's point of view. And there wasn't a whole lot of technique beyond that. So obviously it was a non-directive approach in which the beneficial effect of therapy was believed to ensue from a client's ability to feel accepted and valued, which occurred in the context of this properly fostered therapeutic relationship. It was the relationship itself that was a model for what other relationships in the person's life could be like. So they're not getting that from their spouse, they're not getting that from other family members or their friends or their co-workers or their employer. And so, but by modeling what a loving, caring, empathetic relationship could be like, that was considered instrumental in alleviating a person's symptoms. It's a simple but powerful philosophy, and although most modern therapists, myself included, adopt a more eclectic approach to psychotherapy, drawing what works best from various disciplines and judiciously applying the various principles and tactics to individual cases based on the patient's ability to benefit from a given technique, I do believe that the Rogerian principles of unconditional positive regard, empathy, and openness should underlie every psychotherapeutic relationship. It's a solid and I think necessary foundation from which to proceed and build. So I think it's the first thing you should look for, and you feel it. You'll know because you'll feel it. And it is the basis for whatever other paradigm, whatever other techniques are going to be used in therapy. Good boundaries is very important. A proper therapist respects appropriate professional boundaries. And this ranges from availability issues to issues such as whether your therapist calls you by your first name and encourages you to do the same, to actual touching. With regard to touching, it's acceptable that a light hand on the shoulder, or in some cases even a comforting or congratulatory hug, is within the limits of propriety. But with hugs in particular, it's also generally accepted that the client should be the one initiating or asking for that type of gesture, not the therapist. It's generally frowned upon for a therapist to routinely hug their patients or to ask for hugs, although some therapists might disagree with that. But if a patient asks me for a simple hug, I've found that that's usually okay to grant that request. I do 100% telemedicine now, so it's impossible for me to touch my patients or for them to touch me. But in the past, if a patient said to me, "Can I have a hug?" especially after a session where there was maybe a lot of tearfulness or there's a lot of intimacy, professional intimacy, I would not say no. But if you find yourself wanting to hug or touch your therapist at every visit, that's something that you might want to discuss in therapy. And there's actually a psychoanalytic concept called transference. It's one of the few psychoanalytic concepts that I think is useful and that we do want to attend to. And I won't get into transference or countertransference in this video, but whatever else, a therapist should never make you feel uncomfortable by touching you. If they do, this is something that you have to address, obviously. I learned a valuable lesson once when I extended my arm in an offer to shake hands at the end of my first visit with a patient who was a young, unmarried female Muslim. Despite the fact that she had been reared and educated in the United States, her culture didn't permit her to feel at all comfortable making that kind of physical contact with her male treating physician. Although this intelligent young woman was an adult who had lived and worked independently as an engineer before becoming seriously ill, she came to my office in traditional dress, always chaperoned by her mother. And I learned that at the end of subsequent visits, a warm smile and a simple nod conveyed all the politeness and graciousness that any offer of a handshake could have. More, in fact. By being mindful and respectful of her personal boundaries and modifying my overtures accordingly, I earned her trust and respect. It just wasn't appropriate for her to touch a man or for a man to touch her. And this was pre-COVID, but now handshakes in general, or sometimes we refrain from that. And really, why are we touching each other all the time? That's how you spread germs. I really think that we should stop shaking hands. We don't need to stand 6 feet apart, but I don't think we need to be touching each other all the time. But cultural sensitivity is important. Entitled, self-righteous, ethnocentric individuals, i.e. bigots, are poorly suited for this line of work. So thankfully few apply, but particularly if you're a non-native resident who is reared in a different culture, you want your therapist to be interested in and sensitive to the differences that exist between you. Many clients who belong to a minority class perfectly reasonably prefer to see a member of their own ethnic group to obviate the possibility of cross-cultural misunderstandings. Along the same lines, many lesbian, gay, bisexual, and transgendered individuals prefer therapy offices that are likewise owned and operated, or at least recommended, by members of the LGBTQ community. LGBTQ friendly, at the very least. And the same can be said for any minority group that's subject to discrimination. Regardless, a decent therapist affords all human beings the respect and dignity they deserve. One alarming exception to this, seen today, and it's still legal in a lot of jurisdictions, and that bears mentioning because it's so pernicious, is the example of quote-unquote gay conversion therapy. This is destructive, it's unnatural. All of the professional associations, the American Psychiatric Association, the Psychologists Association, the Texas Medical Association, all of these associations have taken a stance condemning it. And in my professional opinion, it's unethical, it is immoral. The American Academy of Child and Adolescent Psychiatry issued the following policy statement. The Academy finds no evidence to support the application of any quote-unquote therapeutic intervention operating under the premise that a specific sexual orientation, gender identity, and/or gender expression is pathological. Furthermore, based on the scientific evidence, the AACAP asserts that such quote-unquote conversion therapies or other interventions imposed with the intent of promoting a particular sexual orientation and/or gender as a preferred outcome lack scientific credibility and clinical utility. Additionally, there is evidence that such interventions are harmful. As a result, conversion therapies should not be part of any behavioral health treatment of children and adolescents. Thankfully, it's not a mainstream movement in modern-day mental health treatment today, but it is very, very destructive. It's harmful, and especially to adolescents, that's who get dragged in by their overzealous family members. It's not possible to change someone's sexual orientation, whether you accept the fact that it's biological or not, which it absolutely is. Whether you accept that or not, accept that it cannot be changed. I'm talking to any parent out there that might still have some doubts about that, and this industry needs to be shut down. It should be illegal, really, but it's not in a lot of places. Openness. A good therapist is not only sensitive to your comfort level at all times, but is likewise continually open to feedback, including criticism. They don't take things personally or become defensive when you point out your dissatisfaction or your discomfort with some aspect of your therapy. A truly experienced therapist will carefully consider what you have to say and either accepts it at face value if it's a valid criticism, or else explore it with you further if there are questions or concerns about a possible misunderstanding. A therapist who remains transparent, honest, and genuine in their emotional responsiveness to a client, a quality that Rogers called congruence, encourages the client to do the same, and that greatly facilitates the therapeutic process. It leads to greater satisfaction for both the client and the practitioner. We are professionals, we don't take things personally, and that isn't something that just comes automatically with the degree. It is something that some people have to work at more than others, and it is natural to become defensive when you're being criticized, especially if the patient is being, or the client is being really aggressive about it, if they're just upset, and if there's a misunderstanding. So it's important to hear the patient and to validate their concern. I want to talk about spiritual alignment. Some clients specifically seek faith-based counseling services, which includes pastoral counseling. And in those cases, obviously, a person would seek a minister or a rabbi, a priest or a guru, whatever's appropriate to their religion, their spiritual orientation. So if you're atheist or agnostic, it may or may not be important to you to find a like-minded therapist. So a lot of times, if you don't necessarily seek a secular therapist, if faith is just not going to be part of your therapeutic process. But an evangelical counselor who specializes in faith-based therapy with a heavy emphasis on prayer would obviously be a poor fit. So keep that in mind. If you are an atheist, you don't want to go to somebody who's going to tell you to pray and who's going to be always mentioning God and God willing and I'm going to pray for you and that sort of thing. That can be really off-putting. Also realize that while some licensed counselors incorporate their own faith in their work and they specialize in faith-based psychotherapy, clergy are not licensed therapists, not in Texas. In Texas, theology is not considered a, quote, counseling-related field by the Department of State Health Services. And so students of theology aren't eligible for licensure based on seminary work alone. Little can go wrong when compassion is the guiding principle, surely, but when compassion fails to refute dogma, suffice to say, not all religious doctrines are necessarily conducive to the mental health of a given individual. So for some Catholics, going to confession, confessing their sins, and being forgiven by this person who's going to serve as an intermediary between the individual and God, and then tell them to say Hail Marys and see them next time, that can make people feel better. And so I'm not denigrating that one bit. It's not therapy, obviously. And then if they meet with their priest later and they want to talk about it a little bit more, if it's complicated and involves another person and the priest listens and gives advice, that's all well and good. But if dogma interferes and the priest says, no, you can't do this or you shouldn't do that, or it's a sin, and you're offending God, and if so, and they tell them something that's really not helpful, then it might not be helpful. It might not be, and I'm not picking on Catholicism, okay? It could be anything, but it might not be what the person needs to hear. It might not be conducive. So, but if you're a person of faith and it's important to incorporate God in your treatment, perhaps it's better to seek a licensed professional counselor of the same religious affiliation as yourself who advertises faith-based services. Maybe that will be better if you're really symptomatic or you need to involve your partner in couples therapy. And that might be better than simply discussing your problems informally with your clergy person. Although discussing any problem with as many caring individuals who might help is always a good idea, so you could do both, even if you're bound to receive contrasting points of view. That's the only caveat there. But my own personal opinion and my professional opinion is that I consider a strong spirituality an invaluable asset for a therapist to bring to bear in a therapeutic context. If you are a spiritual person, not a religious person, a spiritual person, then you want to bring that to bear. That's part of the wisdom and compassion that you're trying to cultivate and that you're trying to bring to every interaction with every human being, and especially people that are coming to you for help. I'm the same way. I do that. I bring my spirituality every time that I meet with a patient when we're just doing medication management. We have 20 minutes. It doesn't take 20 minutes to talk about milligrams and side effects when we've been doing it for months and they're doing well. But I don't let them go, after 5 minutes. I talk to them for 20. What's going on in your life? What are you looking forward to? What's your biggest stressor right now? I ask them questions. If they say, no, same old, I tell them there's no news. Well, then talk to me about work. Talk to me about your home life. Talk to me. And I bring spirituality to that, even though we never mention God, unless the patient brings it up. But I think that bringing spirituality to bear when it comprises humility and altruism, as opposed to adamant religiosity, on the other hand, that's what I mean by dogma. Especially if it's arrogant and self-righteous, that only exacerbates a person's real life struggles in a way that fails to preserve the autonomy and the dignity of the individual who is suffering. But that's just my personal professional opinion. Other professionals in my field might not agree. Thus far, I've discussed important qualities and characteristics inherent to the personhood of the therapist. These are qualities that can't be taught, obviously. These are qualities that are innate, but they can be cultivated with a sincere effort and an interest in the art of psychotherapy. One question you might ask your new potential therapist is why they chose counseling as a profession in the first place. The answer might give you a good idea about how interested in and dedicated to the practice they are here. Other therapist variables depend on you. Do you have a gender preference? It's okay if you feel more comfortable with someone of the same gender, for example, especially if your issues are gender specific or involve sexuality. Age can be another preference. Many adults prefer a therapist who is at least their age, if not older. It might be hard for someone in their late 50s to take advice from someone in their early 20s. That's reasonable. Whether or not your therapist has ever been married might also be a consideration if you're seeking couples counseling, although I don't discount single therapists who are doing couples therapy. I guess what I mean by marriage nowadays is really not necessarily legally married, but having a partner with whom they cohabitate. That's really what I mean. But I also don't want to discount divorced therapists. They might have even more valuable insights into marriage, as well as the process of extricating yourself from one that isn't healthy, because they went through it. And so I don't think that someone who's been divorced twice makes a bad marriage counselor. Not at all. Not at all. Finally, it's okay to fire your therapist if things aren't working out, but before you terminate the client-therapist relationship, be sure to discuss your concerns openly and honestly. A good therapist welcomes constructive feedback, which might salvage the therapy if it's offered sincerely and early on, or if not, at least it provides the therapist the opportunity to improve for the next client. Also, sometimes a person will become disenchanted with their therapist or with therapy in general because the therapeutic process has become difficult or anxiety-provoking. This might actually indicate progress is being made, albeit uncomfortably, and that therapy should definitely not be interrupted. Having a final therapy session to discuss your reasons for wanting to quit or a different therapist prevents sabotaging perfectly good therapy when it gets stressful, and it helps to avoid therapist shopping, where you're looking for somebody who's just going to tell you what you want to hear. Less commonly, a therapist might suggest or even insist upon terminating the therapeutic relationship themselves and that you find another provider. There are only a few situations in which this is professionally appropriate. In every instance, though, adequate referrals should be offered, as well as instructions as to how to have your medical records forwarded to your next provider, your therapy notes. Of course, people do graduate from therapy all the time, and since that's generally the goal, even with longer-term therapies, it's an occasion to celebrate. It's good to have many advisors in your life, some of whom may be licensed professional counselors, but most of whom will be the people in your life. Family, friends, colleagues, perhaps a member of the clergy, a teacher, a mentor, or any number of other role models. Maybe you consult regularly with a fitness instructor or a dietitian, or there's a home health nurse that's particularly wise and compassionate, and that when you visit with them, you always walk away feeling better or enlightened. Maybe you look up to a supervisor at work. There are enlightened people everywhere if you look for them. Perhaps you're particularly impressed by the works of a favorite author, someone that you don't necessarily meet in person, but you can turn to their work, their artistry. Or maybe you're inspired by the imagination of a great painter or a poet. Anywhere that you encounter wisdom and compassion and a desire to be helpful, even if it is someone that you'll never meet, they're sublimating in order to express themselves. They're artists, but they're also doing the world a service, and you might find great therapeutic benefit from those sorts of things. And therapists will often give reading assignments or recommend certain books. You can find assistance everywhere. And if you go through life with a healthy outlook and the right attitude at the right time and with the right persons, you may be that altruistic guiding influence. Thank you for listening.